I get it, I pay for it. I pay extra, I ain't trying to wait.
Comments also, if you got any, or resources, you can put them in the group chat as well. So with that being said, actually I'll do a little introduction of myself. I'm Eric Peterson. I'm getting my master's degree in counseling and psychological services from St. Mary's University. So I got it in 2 weeks, I'll officially have my degree. So I'm done with my internship and everything. I'm going for my LADC license, so it's addiction counseling license, and then my LPCC license for professional clinical counseling. I've always been interested in psychedelics since my undergrad and their therapeutic potential. So it's exciting to see them pretty close to being FDA approved. MDMA I'm especially interested in. It's kind of my favorite one that I think has some of the most potential, which I'll talk about more. So I will start my PowerPoint and get started. All right. Welcome to MDMA-Assisted Therapy, the Ecstasy Cure. I will explain later why I chose that title. Really kind of what I want everyone to get out of it today is just to understand what MDMA is, how it came to be used therapeutically, talk about the history a little bit, to learn about the therapeutic approach, and then to understand the conditions that MDMA therapy is being used to treat. So I'm going to talk about PTSD at first, and then I'm going to talk about treating social anxiety for people with autism. And then I'm going to talk about MDMA therapy for addiction, and then also using MDMA to help heal relationships. And then I'll talk a little bit about the future of MDMA therapy also. I always like to start off showing this this graph. This was created by David Nutt. He's in the UK Imperial College of London. And him and some other researchers got together, and they ranked different drugs based on harm to others and harm to the user. And I like to show this because there's this misconception that MDMA, which is at the bottom there, ecstasy, is a harmful drug that's harmful to other people and harmful to the user. And if we look at the top, alcohol, which is a legal drug, is got rated the highest. Heroin, crack cocaine, methamphetamine. But if you see at the bottom, there's LSD, mushrooms, and ecstasy, MDMA. So I just like to show this. I'll talk a little bit later about myths around MDMA, but I like to start off with this graph. So the history of MDMA. MDMA, it stands for 3,4-methylene dioxymethamphetamine. It was originally created in 1912 by Merck Pharmaceutical Company, which is located in Germany, and they had a patent on it in 1914. It didn't ever get consumed by humans until like the 50s, I think was the first recorded date. So it kind of just sat on the shelf. They did some testing on it, but they didn't understand the therapeutic benefits until the late 60s, early 70s. Alexander Shulgin, he was a chemist who has a pretty interesting story. I recommend everyone checking him out. He had a DEA license, basically had free permission to create whatever chemicals, compounds he wanted to. So he would create different psychedelics, and then he would try them on himself and see which ones could be used therapeutically. And so a grad student of his introduced him to MDMA again, and he took it and realized that there is a therapeutic potential to it. Claudio Naranjo was also partners with Alexander Shulgin. They did research together, and Claudio liked to use MDMA in groups, usually with 12 to 16 people. So I found it interesting because he was just talking about, I was doing some reading on him, and he was talking about how in group settings, he often would just give people the MDMA and not really do a lot of directing. The group just started to organize around itself, and healing started to occur, which I'll talk about later. And then Alexander Shulgin was friends with Leo Zeff, who was a therapist that used LSD in the early 60s. And Leo Zeff basically kind of made it his mission to train as many therapists as he could in how to do MDMA therapy. Trained over 1,000 therapists and responsible for tens of thousands of MDMA sessions that occurred in the late 70s. This was all before MDMA became illegal. So it wasn't legal or illegal. The DEA just didn't really know about it until the early 1980s when people started to take it recreationally. I also want to point out Anne Shulgin, who was married to Alexander Shulgin. She also did MDMA therapy. and she was responsible for the spread of the knowledge around its therapeutic benefits. And then in 1985, MDMA became classified as a Schedule I drug, which went against medical professionals and therapists' advice and religious leaders' advice that MDMA was helpful and there was therapeutic benefits to it. Schedule I drug means that in that category, that drug has no therapeutic benefits and it is highly addictive, which is completely false regarding MDMA. The reasons for making it illegal were completely political, and there really was no reason for them to classify it as a Schedule I drug. And now I'll talk about a little later. We think that MDMA will be FDA approved by 2021. So that's about 35 years that they've been trying to get MDMA legal again. So it's been a lot of hard work and a lot of hard effort. And then in the 90s, people started to take it at concerts, at festivals. It enhances your senses, so people like to take it, listen to music, go to concerts. But as it started became used more recreationally, there was dangerous chemicals that were just called MDMA or ecstasy that were not always safe for people. So when you make a drug illegal, it just goes underground and people don't always know what they're getting. So that is where a lot of misconceptions about MDMA came from. And this is Claudio Naranjo up here, this picture of him as a painting done of him. So that's just a little history of MDMA. I'll talk a little bit about the effects of MDMA. Normally the dosages that are used in research studies, usually around 100 milligrams, 125 milligrams. The effects last 6 to 8 hours. When people take it, it usually takes 30 to 60 minutes for the effects to be felt. And in the brain, it increases serotonin, dopamine, oxytocin, and norepinephrine, which is important because that helps. Someone jumped in. That'll help explain some of these subjective effects. And they've done a couple brain scans with people under the influence of MDMA. And they found out there is decreased activity in the left and right amygdalae. And then there's also increased activity in the prefrontal cortex. So why MDMA is helpful for people with PTSD is people with PTSD often have an overactive amygdala, a heightened response to fearful stimuli. What MDMA does is it reduces that fear response, and then it increases blood flow to the prefrontal cortex, which allows people to logically think through traumatic memories and be able to process them. The subjective experience of MDMA. So this is Alexander Shulgin here. This is him and Anne Shulgin. This was his garage where he created all of his chemicals. He's like I said, pretty interesting guy. But when people take MDMA, they report pro-social effects. So feelings of intimacy, feelings of love, compassion and empathy. A deep compassion for yourself and for others is part of the MDMA experience. And they didn't want to classify MDMA as a psychedelic, so they created, David Nichols created the word empathogen, which means a drug that produces empathy. They also coined the term entactogen, which means to touch within. So MDMA allows you to look inside yourself and it's an inside drug. It allows you to look into your thoughts, patterns of behavior. Then like I was saying, there's a reduction of fear and anxiety when you take MDMA. It allows people to go into their trauma and go into their pain. To be able to face it and be able to process those emotions. And then there's usually enhanced sensations, visual and auditory sensations. Music is a big part of MDMA therapy. And then kind of why I chose this title is it produces a state of ecstasy, which I was trying to do a history, find the history of the word ecstasy, and there's just a lot of, different approaches to what that word means. But really what I got out of it is a feeling of euphoria or intense joy. It also can be described as a mystical or spiritual experience where you feel connected to something outside of yourself. You feel connected to nature, feel connected to the world. And then it is a holotropic state of consciousness, which is different than the term altered state of consciousness. Stanislav Grof coined this term, and he likes to use it because holotropic means moving towards wholeness. So MDMA can produce a state of consciousness that is healing. It's transformative, and it can help people strive to reach their full potential and increase their quality of life. Some myths about MDMA, which I think are important to talk about, is one One of the myths is that it's severely damaging to your brain. People will say MDMA puts holes in your brain. That's not true. Where that came from is they did a research study, some people, and they gave mice methamphetamine. It wasn't even MDMA, and they gave just a ridiculously high amount of meth. And then they scanned the brains of the mice that had taken the methamphetamine and that hadn't taken it. And to show the brain differences, they just put like a black hole on the scan, and the media picked that up and took it as like MDMA puts holes in your brain. So if you ever hear that myth that MDMA puts holes in your brain, that's just not true. Another myth is that MDMA is highly addictive, which it isn't. Most people do not develop substance use problems around MDMA. In my practicum experience, I didn't see one person that was addicted to MDMA. I'm sure other therapists can say the same. Another myth is that it depletes serotonin permanently. This isn't true as well. It does interact with serotonergic receptors, but there isn't really evidence that there's long-term damage to those serotonin receptors. And then another myth is that Molly is pure MDMA. So Molly is a street name for MDMA. It comes in a crystal or powder form. And when it's sold on the street, people are told that it's pure MDMA, but that is also not true. So these are just some myths that I like to talk about, which are important because it hinders the progress of MDMA therapy when there's misinformation out there. So these are important things to talk about. So now I want to talk about post-traumatic stress disorder. It's a complex biopsychosocial condition that really does not have many effective treatment options. So what are the symptoms of PTSD? One of those symptoms is hypervigilance, which is a heightened awareness, or people are always on alert. If somebody was attacked by someone and that was the traumatic memory, anything that reminds them of that attack will lead to intrusive thoughts or memories. So if someone was attacked by someone in a red hat, anytime they might see a red hat, they might get triggered. Their heart rate might increase, their blood pressure might increase. They're going to think that there's a threat. And then they might have intrusive thoughts or memories of that attack. So it's a debilitating condition that really affects people's relationships with others. It affects their ability to work. It affects their ability to sleep. And then people will often have avoidance symptoms. So they'll avoid certain places, people, or things that will remind them of that traumatic event, which again can be not helpful to them. An estimated 3.6% of US adults had PTSD in the past year. And then, like I was saying, it can have negative effects on sleep, relationships, work, physical health. And then the problem with PTSD, I think, is that the current pharmacological treatments, such as Zoloft or Paxil, SSRIs, they attempt to reduce or suppress the symptoms without getting to the root of the issue, which I think is important because the difference between those medications and MDMA, that those medications are meant to be taken daily, and they're meant to mask the symptoms of the intrusive thoughts and memories. And it's supposed to reduce anxiety, but they're not meant to be taken long-term. And the clinical effect can also take up to 14 days, which is a long time for some people when they're wanting to be able to manage their symptoms, and they're gonna have to wait a couple weeks for those effects to take on. There also isn't long-term efficacy with those medications. They're not meant to be taken every day for years on end. And then they have a higher dropout rate than MDMA in the different research studies. So PTSD, there's 23 veterans every day die by suicide. So this is something that really needs to be addressed, and people need more treatment options for it. I have some patients that have been diagnosed with PTSD for 15, 20 years and nothing's worked for them. And again, that's why I think it's important to have these conversations and talk about MDMA therapy because people are hurting, people need to get healed. And the research has been showing that this is very effective. This is Michael and Annie Mithofer. They are some of the MDMA researchers on the clinical trials. I would check out their work. They helped to write the MDMA therapist training manual. And then the approach to treatment is it's similar to regular therapy, but there's also some differences. So the therapeutic effect is the medicine, which is MDMA, the therapeutic setting, the mindsets of the participants and the therapist. So it's a combination of all four of those things that are producing the therapeutic effect. So it's not like the MDMA is 100% reason that people are getting healed from their PTSD symptoms, but it's a combination of all of those. And then the inner healing intelligence is used within psychedelic therapy. And what that means is that it's just the body and the mind's natural attempt at healing. So MDMA catalyzes the inner healing intelligence. And then it also helps with the therapeutic connection, which I think is very important because people sometimes go into therapy and they're nervous, they're scared, they don't know this person that they're supposed to be talking to. And it's difficult to open up to strangers. MDMA, it can produce experience of empathy, love, and deep appreciation for other people. Also, oxytocin, it has to do with bonding, the neurotransmitter. So that's where MDMA can be helpful with strengthening the therapeutic relationship, which is essential for therapy. And when it comes to PTSD, people go through the MDMA experience and they have a clear perspective of trauma that is in the past and a heightened awareness of support and safety in the present. So they're able to realize that if they do get triggered, they aren't under threat right now. They're able to realize that that trauma happened in the past and they don't need to be affected by it in the present. So let's see here, a couple people coming in. So the whole therapeutic process, somebody mute here, thank you. So the therapeutic process, they start off with preparation sessions, which is, again, you're establishing the therapeutic alliance. They usually do 3 or 4 sessions of just regular psychotherapy, 90-minute sessions. And in those sessions, they'll prepare for the MDMA session. They'll talk about what is the person wanting to get out of the session, what are they wanting to process, what are they wanting to talk about, what are they wanting to work on. They'll discuss the use of touch. And then music also is an important part of MDMA therapy. So people will often have their headphones in and eye shades on, and they'll do a lot of internal work. And they'll go inside of their mind and they'll kind of just evaluate their life without talking to the therapist. So it's a lot of internal work. And then when they do the MDMA-assisted session, the approach that's used in the clinical trials is considered non-directive. So again, the person will start off laying back on a futon, put their eye shades on, put their headphones in, and then they'll try to get a relaxed state as the effects of MDMA come on. And if they want to talk to the therapist, they'll start talking to the therapist. If they want to just keep the eye shades on and be working internally, they can do that. So it's up to the client what they want to do. And there's also a directive approach where the therapist is doing more directing. They might be talking more with the client. They might be making suggestions. So there's 2 different approaches for how the therapist is going to act in the MDMA sessions. And then after the MDMA session, they will do integration sessions, which is really just about making sense of the MDMA experience. It's about applying insights to form new thought patterns and habits of thinking. It's really just kind of taking what you learned and then applying it to your life. What changes are you trying to make? What did you learn in the MDMA session? How did you think about the world differently? How did you think about yourself differently? And that's where the integration sessions are important, because if you didn't do the integration, then what you learned in the MDMA session would just stay there. So it's about taking what you learned and applying it to your everyday life. And then the integration sessions are also about preparing for the next MDMA session. So usually there's only, in the research studies, there's 14 to 16 therapy sessions and only 2 or 3 are with MDMA. So it's preparation, MDMA session, some integration sessions, another MDMA session, and then some more integration. Up here in the corner, this is Stanislav Grof and his wife, Christina Grof. He was considered the godfather of LSD. He's witnessed over 4,000 LSD sessions with patients. I really encourage people to check out his work also. So the overall goal for MDMA therapy for treating PTSD is, number 1, just to reduce the symptoms of PTSD. The hypervigilance we were talking about, the intrusive thoughts and memories, and then the avoidance behaviors. And then it's meant to improve the overall functioning, well-being, and quality of life of the participant. People with PTSD, it can often harm their relationships. There might be a lack of trust. They might have difficulty regulating their emotions. It can lead towards conflicts with other people that they're in relationships with. And then sometimes it'll go beyond processing the trauma, and people will explore other psychological areas of their life, interpersonal areas and spiritual aspects as well. So usually whatever happens in the MDMA session, there's a reason why that material comes up. Stanislav Grof describes MDMA and psychedelics as non-specific amplifiers. And so if people are experiencing joy, With MDMA, they will have heightened joy, or they'll feel extra happy. If they're experiencing fear, they might experience more fear than usual. So really whatever comes up in the MDMA session, there's a reason why that is coming up. This book right here is really interesting, The Secret Chief. This is Leo Zeff. Kind of just describes his history of his life and what he did with MDMA therapy. So I recommend checking that out as well. So right now where MDMA therapy is, it was granted FDA breakthrough therapy status. And what that means is that because of the phase 2 results, the FDA thinks that MDMA therapy is more effective than other treatment options that are currently available for people with PTSD. They are currently on their phase 3 of research, which has been delayed due to COVID. So it might be 2022 before this is made legal. And because of the results, it was granted expanded access. And what that means is that there's 10 sites, I believe, that were able to apply. And that just allows more people to have access to this treatment without having to join a research study. So the only way currently you could have MDMA-assisted therapy legally is if you joined a research study. So what the expanded access program does is it allows more people to have access to this type of treatment. The phase 2 results, I think, are very important. This was for people with treatment-resistant PTSD. So again, this is people who have tried 2 or 3 different medications, different types of therapy, and nothing has worked for them. So this is kind of their last resort, was coming to these MDMA therapy studies and to see if they could get help. They had 107 participants in the phase 2, and 61% no longer qualified for PTSD after 3 sessions of MDMA-assisted psychotherapy, 2 months following treatment. And then at the 12-month follow-up, 68% no longer had PTSD, which is remarkable. Again, keep in mind, these are smaller scale studies and they have to cherry pick their population. So these are people that are just diagnosed with PTSD. They can't be diagnosed with other conditions. But it just shows that there's something there and that it's working and people are benefiting from it. And then Michael Mithofer, he has a paper that's talking about memory reconsolidation and fear extinction. And what that theory is that when people recall a traumatic experience, there's normally the emotions of fear attached to it. And so whenever that memory gets recalled, their body just goes into a state of having to defend off a threat. They're very afraid, they're terrified. And what MDMA therapy does, it allows people to recall that trauma, it allows them to process it, and it reduces the fear that's attached to it, and then it might add another emotion that's attached to that memory. So then after the MDMA sessions and later on in their life, if that memory is recalled, they don't go into such a fearful state, or they aren't overwhelmed by painful and negative emotions. There was a long-term follow-up done by Michael Mithofer, which I think, again, is important to point out, because they had 19 participants and the average length of PTSD symptoms was 19 years. So these were people that have had PTSD for a long time. And what they found out is that the effects lasted up to 3.5 years, which is a lot longer than, like I was talking about, the SSRI medications and other pharmacological options that are currently out there. So MDMA therapy is showing long-term results where the effects are sustained and people are benefiting from it. And keep in mind, that's only 2 or 3 MDMA sessions. So it's not like they're taking the MDMA home with them. They aren't taking it every day. It's just a couple sessions and then there's long-term effects. The results, they did like a long-term follow-up questionnaire, and none of the subjects reported that they were harmed from participating in the study. And then another important thing is that all of them answered yes to the question, do you believe more MDMA sessions would have been helpful? So it could be that in the future, maybe people go back once a year, every couple of years for another MDMA session, kind of like a booster session or a maintenance session. And that's something that future research should explore. So they also, from this long-term follow-up study, there's a minimal risk of substance abuse. So there's nobody that went out to seek illegal MDMA and to use it recreationally. One person tried to create their own therapeutic setting with a friend. And they had gotten some MDMA and tried to have a therapy session on their own. And they reported that it just wasn't the same. So people might think that, hey, people join these MDMA-assisted therapy studies and then they're just gonna start going on the streets looking for MDMA. But as we can tell from some of the long-term follow-up studies, none of the participants did that. And then Majority of participants endorsed benefits such as increased self-awareness and understanding and enhanced spiritual life. So it allowed people to just have insights into their thoughts and into their behaviors, which allows them to then make changes. Nobody said they were harmed cognitively by the MDMA-assisted therapy. And then the majority said that their memory, concentration, and thinking approved. This wasn't validated by any studies. These were just self-reports, so keep that in mind. But people said that they benefited from it. And really, I'm more interested in the subjective experience and the personal experience of people. So now I want to talk a little bit about autism. MDMA-assisted therapy isn't trying to cure autism. It's just treating social anxiety that people with autism have to deal with. So people with autism, sometimes their internal world is more intense or chaotic, it could be described as, and the impact of external stimuli is more stronger and unpredictable. It's a developmental phenomena, and people with autism, they think, behave, and interact with their environment different than people that are considered neurotypical. So there's nothing wrong with being diagnosed with autism. It's just that our society doesn't benefit people with autism. It's not designed to help them. It's designed to help people that are considered neurotypical. And because of that, because society isn't there to help people with autism, they might experience social anxiety, which is characterized by a fear of scrutiny and avoidance of social interactions. So people with autism, it's sometimes difficult to interact with others. They might not be able to read facial expressions as well. They might not be able to understand sarcasm, and they might get bullied, and usually at a young age, which can be traumatic. And this trauma at a young age can then develop into manifesting more symptoms of anxiety, depression, and then it can make it more challenging to adapt in social settings. So prescription medications aren't helpful, again, for these symptoms. They don't get to the root of the issue, which is usually fear. The root of anxiety, it's usually fear or worry. And new treatment options need to be available for people. Same with PTSD. There needs to be more ways for people to access this treatment. So there's a small study done by Alicia Danforth. We had 12 participants. They had 8 in the MDMA group, 4 in the placebo. The MDMA group, 4 of them started off with 75 milligrams their first session, and then their second session they had 100 milligrams. And then the other 4 in the MDMA group started off with 100 milligrams, and then their second session was 125 milligrams. The results was there was a significant greater difference in LSAS scores, which is the Leibowitz Social Anxiety Scale, which is just a scale that measures avoidance behaviors and fear in certain social situations. So if somebody has fear of talking in front of a group of people, that is what it measures. What is their fear in that situation, and then do they try to avoid that situation? So there's a significant greater difference in those scores for the MDMA group compared to placebo, and that was at the 1-month endpoint and then also at the 6-month follow-up. So showing right there that there's long-term effects of this for treating social anxiety as well. And again, I like to focus on the personal experiences of people. And after the MDMA sessions, the participants reported that they were more comfortable with looking people in the eye for a longer period of time. And then it increased their ability to verbally express emotions. So again, it's just allowing people to interact with others. It can help increase confidence and reduce anxiety. 11 of the 12 participants reported marked reductions in anxiety responses to triggers that were previously distressing for them, such as making a presentation, speaking on the telephone, entering new social settings. So again, it was just helping people be more comfortable around others. There was a reduction in fear. They were more confident to approach other people. Some people were able to initiate dating for their first time, which is important, which is big. And then relationships with family and friends improved due to increased social skills, being able to read facial expressions better, being able to talk with people, not feeling so afraid of putting themselves out there in social situations. And it appears that MDMA-assisted therapy helped participants feel calmer and more confident when interacting with other people in social situations. That was the kind of one of their main conclusions in the discussion section of the research paper. So now I want to talk a little bit about MDMA being used to heal relationships. So before MDMA was made illegal, it was used a lot in couples therapy and in group settings also. Rick Ingrosky was one of the early researchers with MDMA. So I'm going to read this quote of him that's describing the MDMA effects. "It puts a person in an unbelievable open frame of mind. The expanded capacity for self-awareness, the expanded sensitivity, the increased ability to share feelings, all that's attributable to the lowered fear and anxiety induced by this drug." So again, the effect of MDMA, it just allows people to open up more. It allows people to talk about things that they normally repress, emotions, memories that they normally don't want to talk about. And this is him describing him doing MDMA therapy with couples. To sit with a couple as they kind of opened up, and you facilitate the process a bit. But quite frankly, once things get rolling, it's like they just kind of go where they need to go. What MDMA does is actually removes the fear of being real, of being authentic with yourself and with other people. Afterwards, you don't need to take MDMA in order to experience authenticity. So I put this image of a key down here because I think that helps to describe the MDMA experience. And what I put the key there because it symbolizes unlocking certain emotions and certain ways of viewing the world and navigating the world. People often repress and hide. We have a layer over ourselves as a defense mechanism. We don't like to open up. We don't like to talk about our struggles. And what MDMA does is it gets rid of those defense mechanisms, and it allows people to just be real. It allows people to be themselves. It allows people to be authentic, which is helpful when you're in a relationship and you're masking things and you're not wanting to talk about problems with your partner. Taking MDMA can make people feel more comfortable about talking about those difficult things. And then it also can lead towards healthier communication. It can strengthen trust in bonding. Like I was saying, it decreases defenses. And then MDMA, it makes you honest. People are honest with themselves and they're honest with others. Sometimes in relationships, there might be trust issues. People might not want to talk about things they did in the past. And MDMA allows people to feel comfortable with talking about those difficult emotions or those difficult memories that they normally are pushing away. MDMA in group therapy, I think it definitely could be helpful in group therapy. MDMA isn't as intense as, say, LSD or psilocybin or other psychedelics. It's a little more gentle, I would say. I think people can interact with others better. So it allows people to communicate in a more direct, honest, and compassionate way. And it can help form a tighter bond between people that is more secure and safe. And oftentimes in group therapy, I'll be leading group and people just won't want to talk about things. There might be 10 people in the room and it's tough to just open up to a bunch of strangers. And what MDMA can do, again, it can reduce that fear and allow people to feel more comfortable about talking to people they might not know as well. I think future research will start to look more at using MDMA in a group setting. And then there has been some research where it's been shown to change the way people talk to others. So using more social words such as empathy, friend, and support. There's been a couple of research studies where they've given people MDMA and then analyzed their vocabulary. And compared to the placebo group, the MDMA group used more social words, which I think could be helpful, also being used for couples therapy as well as changing the vocabulary that people use to talk to one another. So addiction is a very big problem in our society. Alcohol use disorder, there's 88,000 alcohol-related deaths annually. All those deaths aren't related to addiction specifically, but again, this is a legal drug that has serious consequences to our society and to people as well. There's 3.3 million deaths worldwide, and it costs U.S. taxpayers $250 billion. So again, there's not very many effective treatment options for people with alcohol addiction. Usually treatment efficacy is 30 to 40% at best, I would say, using 12-step facilitation, cognitive behavioral therapy, motivational enhancement therapy. There just needs to be more options for people with addiction. Keeping in mind that people with addiction are often traumatized. They often have a lot of childhood trauma as well. And what MDMA does is it gets to the root of the addiction. And that's Ben Sessa started a study. He's in the UK, and he started a study for MDMA-assisted therapy for people with alcohol addiction. Just a small scale study. All they're doing is just giving people MDMA. It's an open label study, so everybody knows that they're getting it. And really the goal is to treat the underlying cause of the addiction. People become addicted to drugs because it's their coping mechanism for pain that they've experienced in their life. It's their lifeline. It helps them get through the day. And what MDMA does is it gets to the roots of the addiction. It gets to the fear, it gets to the trauma, and it helps people process those experiences that are driving them towards their addictive behaviors. And so in their first stage, they had 12 patients, 2 turned back to drinking, 5 have not had any alcohol, and 5 have had a few drinks but have not gone back to their normal amount. So some good results for a small scale study. So that just shows that future research needs to be done around treating people with alcohol addiction. And again, people might wonder, well, you're using a drug to treat an addiction to another drug. But again, we have to look at why people become addicted to certain drugs. And MDMA doesn't allow people to hide from their pain. It brings their pain and it brings their fear up to the conscious awareness. And that's why it can be helpful to be used in therapy for addictions. People use drugs to push things away, to push material away. And MDMA brings that material up for processing and for people to resolve it. So in conclusion, how does MDMA help people improve their lives? I think the experience of love that people might have in MDMA is essential, because it's this deep appreciation people will have for themselves. They'll learn to love themselves for who they are, for their true, authentic, genuine self. And they'll have more compassion for themselves and empathy, and also for the world and other people around them. MDMA can be described as a love drug, I would say. That was coined by Anne Shulgin. And really it's the experience of just a deep appreciation for yourself and for life. It's also an insight drug. Like I was saying, it gives people insights into their behaviors and thought patterns. And that's the point of therapy, is to change thinking and to change behaviors. And that's what MDMA allows people to do. And then it also can change the core beliefs about themselves. If someone had a childhood experience where they told they weren't good enough, they aren't worthy of love, they don't deserve love, people hold on to those beliefs. And now they're 50 years old and they're depressed and they're hopeless and they think they're worthless. MDMA, having that experience, can change those core beliefs. It can help people resolve those childhood memories and those childhood emotions that are manifesting in mental health symptoms in their present life. And it also enhances communication, like I was saying, between self and other people. As humans, we're relational beings. We have relationships with other people, and MDMA can help improve those relationships, which can in turn help improve people's personal life. And future of MDMA. So kind of what I see is that, like I was saying, by 2022, it'll be FDA approved MDMA therapy for PTSD. And what I think they're going to do is start using it for adolescents with PTSD and do research around that. So that is kind of the future of MDMA therapy for PTSD, is using it with adolescents. And then there's also a study started that's being used to treat people with eating disorders. And again, I think the root cause of that is often trauma as well, or just not having a love for yourself or a deep appreciation for who you are. So I think MDMA can be helpful for that as well. And depression. A lot of the PTSD studies, the secondary outcome measures, they will use scales to measure symptoms of depression, and people often will resolve those symptoms. They won't feel as hopeless anymore. They won't feel as worthless. They'll have a more positive outlook on life. And then addiction also, I think it might be used to start treating people for their addictions to other drugs or other behaviors as well. And then palliative and hospice care. So MDMA, before it was made illegal, it was being used to treat anxiety for people that were diagnosed with a terminal illness. And again, MDMA can help people overcome their fear of death. And it can also resolve those symptoms of depression that people that have a terminal illness might be experiencing. So again, it's the reduction of fear and the reduction of those symptoms of depression that can help people become more comfortable knowing that they are going to be dying and it won't end on this earth. There might be another life that they'll be going to. And so MDMA can help resolve that anxiety around death. And then also marriage and family therapy. I think there will be more future around that as well. I think family therapy could be very interesting with MDMA. I don't know of any research studies around that. But again, this is some future research that can be explored. So that is got some references here. That is that's about everything. I didn't talk too fast, did I? Cool. We can just let's just open it up to questions, discussion. Feel free to turn your cameras back on if you want. You don't have to. Yeah, Betsy. Oh, you're muted. Betsy, can you unmute yourself? Oh, well, seems to not be working. Someone had a question in here earlier. Any use for anxiety from post-concussion syndrome? Karen asked that. I don't know. I don't have an answer for that one. I'm not sure if there's been any research around that. Yeah, Betsy?
I'm sorry, I got hooked up. I'm sorry to take so much time.
No worries.
I have very mixed feelings hearing this because I think I'm a prime candidate, but I'm an old lady and probably wouldn't qualify for a research study. But I know, I've never taken MDMA, but having heard about it and understanding the therapy, and I have PTSD. So that would be so wonderful. But I might not be alive when they okay that.
Yeah.
Just throwing it in.
Yeah, no, yeah, that's one thing is increasing access to this treatment because there is a age cutoff and there's different conditions they won't treat. So that's why I think it's helpful for future research to start exploring other populations of people that aren't being able to access these treatment services.
Like elders.
Yeah, yeah.
Other people call us senior citizens. I prefer elders.
Yeah. Yeah, no, I think that's for future research to start looking at also.
Thank you.
Yeah, thank you. Yeah, Todd.
I think that either if it's been in another group where you've been kind of teaching or not, but I've had this question answered, but just to clarify, kind of in the context of addiction treatment. So when the FDA does approve it, it will only be for people that have an actual diagnosis of PTSD?
Yeah, I think so. I don't know if people will be able to prescribe it off label. I don't have an answer actually for that.
No, and your slide on addiction made complete sense. And the other thing too is I can see it being so applicable because there's so many realms of life that can affect someone's recovery. So even if somebody went into like a standard 30-day treatment facility, that it could still be applied post that, that's when the battle begins anyway. People are, they don't get cured after 30 days. So that's when the real battle. So it's awesome that that's just available or potentially available. I mean, it could even just kind of nourish, because sometimes we talk about it in meetings, once a year, like a psilocybin just to kind of boost. But I mean, this as well, because the more you get in recovery, there was hidden trauma often that people either intentionally kind of forgot about or were never aware of. So the more you start healing, the more you can become aware of past. So just to have that available, just to kind of nourish one's recovery sounds very wise. So no, I just love the way you were kind of presenting that.
Yeah, and that's why I think it's important to talk about it because people that have the abstinence model, they might say you can't take MDMA to get over alcohol addiction, but people are prescribed naltrexone, which is used to reduce cravings for alcohol, which is a drug. People are given SSRIs, they're giving other medications. And again, the MDMA, it's not something that people develop addictions around. And again, like you were saying, Todd, it kind of gets to the root of that addiction, which is oftentimes unresolved trauma.
But yeah, because somebody can be, there's a lot more to recovery than just stopping drinking or stop using your drug of choice. It's those internal battles that can be, and so just the fact that this potentially is available, I don't know.
Yeah. And that study was done in the UK, so I don't know if they're trying to get any studies here in the US. I'm not sure about that. But what's that? Any other questions? Yeah, David?
Yeah, so I guess maybe you already answered this, but I'm curious as to like what the actual process, you know, since it's Schedule 1, like, does that mean that with FDA approval or something, it remains Schedule 1 but is approved, or does it get decriminalized automatically?
No, I think it, you know what? I don't have an answer for you on that one. But basically what it is that in order to use MDMA as a therapist, you have to go through a training program by MAPS, Multidisciplinary Association of Psychedelic Studies. And they have a patent on MDMA. So I think the only way you can use it as a therapist is if you go through their training program and get it from them. But yeah, I'm not sure exactly what happens with the...
So that's actually like my real question. I'm just kind of concerned like if this is something that will only be in the hands of psychiatrists versus other clinicians, or if it's going to be available to anybody who does this program.
It'll be, I think right away, it'll be kind of slow to get things started. MAPS has a patent on MDMA, and then, so you only can get it from them, but all of the profit then goes back into their public beneficiary corporation, which goes all back into the research. So everything they're going to sell the MDMA to therapists, but then that money is going back into the research.
Sure. I guess I just mean, do they allow like psychologists and social workers and other people who aren't like medical doctors to do it, or is it just...
Oh yeah. Yep. You can be a licensed clinician.
Cool.
Yeah. So there's more options. Thank you. Any other questions or comments? Yeah, Todd, is your hand still up there? Oh, cool. Could have just an open discussion if anyone wants to. Cool. Well, thank you everyone for attending. I hope you learned something or benefited from it. There will be a recording. If you have any questions or just want to reach out or talk.
You wanted to comment on any of those that if they caught your eye in the
oh yeah, I see that. Yeah, what is cranial sacral therapy? What is that?
Cranial sacral therapy?
Yeah.
That's a form of body work. There's a lot of different types of body works that can be real body mind integrating.
Okay.
Oh,
cool. Cool.
And yeah, I remember like McKenna, as far as mushrooms would go, he would say like massage or body work and mushrooms were incredible for the type of healing that could be done. Mind, body, spirit type of integration.
Yeah, well, that's
curious.
Yeah,
and also like Ron Kurtz, the body-based psychotherapy, loving presence. What was his Hakomi? I think he did. But
yeah, that's an important part of MDMA therapy is also the somatic and body processing. So people will often, they might, during the MDMA sessions, they might shake a lot. They might have a lot of physical movements, and that's a lot of the trauma that's stored in our body being released. So yeah, you're right. There's a lot of somatic work involved with MDMA sessions also.
Cool.
So
I used to have a book back in the 80s, and I keep looking for it. It was a psychotherapist's manual for the use of entheogens. It was Ecstasy and other, no, not entheogens, but empathogens, it was called.
Okay.
Pathways, and it was called Pathways Through the Heart.
Oh yeah.
And it had a few different, oh, you have that?
I've heard of it. Yeah, that's another resource for people is Pathways Through the Heart. That's another good one.
Yeah, that was a good one. But I've looked for it. I'm just surprised I couldn't find it on Google, and I loaned it way back like 90 and I never got it back. But yeah. Anyway, I look forward to catching the recording again, and thanks,
awesome.
Eric. I got to run.
Cool. Thanks, David. Yeah, thank you everyone for attending. Again, there will be a recording of this if you want to send out to other people. So thank you. Have a good weekend. Again, feel free to reach out if you want to talk or ask any questions. Send me a message on Meetup. I'm willing to chat. So yeah, have a good night.
Thanks, Eric.
Thanks, Eric.
Yeah,
that was a good presentation.
Yep. Take care.
Thanks, Eric. Nice job.
Thank you. Have a good night.
Thank you.
Thank you, Eric. Nice job.
Yes, thank you. Have a good night.
Bye.
Yeah.